Colorectal cancer is the third most commonly diagnosed cancer worldwide, and it's a leading cause of cancer-related deaths. Over 900,000 people die from it each year, making it a serious health concern. In the U.S., it's the second leading cause of cancer death for both men and women. Cases are rising among those under 50, prompting new guidelines to start screening at 45 for average-risk individuals. Risk factors include family history, obesity, smoking, and diets low in fiber. Recognizing symptoms like rectal bleeding and weight loss can lead to earlier diagnosis. Awareness and timely action through screening can help combat this preventable disease. This presentation will cover 12 key symptoms to watch for, helping in early detection and prevention. Colorectal cancer is the third most diagnosed cancer globally. While incidence rates have decreased, there's a rise in cases among those under 50. It often starts as benign polyps, making early screening vital. Risk factors include age, diet, and lifestyle. Tumor distribution varies within the colon. The sigmoid colon and rectum are the most common sites, accounting for 54% and 29% of cases, respectively. Risk factors for colorectal cancer are divided into non-modifiable, meaning factors you cannot change, and modifiable categories, which are factors that can be changed. Age, family history, inflammatory bowel disease, and genetic syndromes are non-modifiable, while diet, obesity, smoking, heavy alcohol use, and type 2 diabetes are modifiable. Now let's look at key features of colon and rectal cancer. First, change in bowel habit. Changes in bowel habits, such as diarrhea or constipation lasting more than a few days, can indicate a tumor. Tumors may obstruct the colon, disrupt motility, or cause inflammation affecting bowel function. Bleeding is another key feature. Rectal bleeding or blood in stool is a common early symptom of colorectal cancer and should never be dismissed, especially in individuals over 45 or those with risk factors. It may be visible or hidden, often painless, and can lead to anemia. It is often due to tumor ulceration causing fragile tissue that bleeds easily. The next symptom is narrow or ribbon-like stools. This change in stool shape indicates a narrowed lumen and especially suggestive of left-sided colorectal cancer, where the stool must pass through a progressively constricted area. Though not exclusive to malignancy, persistent stool caliber changes are a red flag and should prompt colonoscopic evaluation. A feeling of incomplete bowel emptying may occur due to partial obstruction by a tumor. This sensation is caused by altered bowel motility and rectal wall involvement, disrupting normal defecation. Tenesmus, an urgent and often painful false urge to defecate, is another key feature. It is caused by tumor invasion of the rectal wall, often associated with mucus discharge or pain. Obstruction and local inflammation contribute to this persistent sensation. Persistent abdominal discomfort, including cramping and bloating, can result from tumor growth. Right-sided tumors are particularly insidious, often growing large before symptoms manifest, while left-sided lesions more readily produce colicky pain due to narrower lumens. Partial bowel obstruction and inflammation around the tumor contribute to ongoing pain and discomfort. Another important feature is anemia. Unexplained anemia may indicate chronic blood loss from a tumor, leading to iron deficiency anemia. Cancer-related inflammation and reduced nutritional intake further exacerbate this condition. Fatigue and weakness are common symptoms due to anemia and cancer-related inflammation. Reduced nutritional intake from appetite loss or bowel changes leads to energy deficiency and overall weakness. Clinicians should maintain a high index of suspicion when fatigue coexists with GI symptoms or weight loss. Nausea or vomiting can occur from bowel obstruction due to tumor growth. Tumor-related inflammation or metastasis may irritate the gastrointestinal tract, affecting gastric emptying. Unexplained weight loss is a significant symptom warranting medical evaluation. Cancer-related inflammation increases metabolic demand, while tumor-induced appetite suppression reduces nutrient absorption. It is often associated with advanced disease and correlates with worse prognosis. The sudden eruption of multiple seborrheic keratoses may represent the Lézer-Trélat sign, a perineoplastic phenomenon associated with GI malignancies, including colorectal cancer. Though rare, recognizing this dermatologic clue is essential, particularly when accompanied by other GI symptoms. The rapid increase in keratoses results from tumor-derived growth factors stimulating epidermal proliferation. Rectal prolapse can occur when tumors in the rectum or sigmoid colon act as a lead point for intussusception. Weakened pelvic support and increased intra-abdominal pressure contribute to this condition. If you notice these signs, consult a healthcare professional promptly. If you're experiencing symptoms like rectal bleeding or changes in bowel habits, don't ignore them. Schedule an appointment with your healthcare provider for a thorough evaluation. They might recommend tests like stool samples, blood work, colonoscopy, or even imaging. Management of colon and rectal cancer typically involves a combination of surgery, chemotherapy, and radiation therapy tailored to the stage and location of the tumor. Early detection of colon or rectal cancer can significantly improve treatment outcomes. Even if you're under 50, advocating for your health is crucial. Don't wait. Your health matters, and taking action could save your life. Colonoscopy is the gold standard for colorectal cancer screening and prevention. It allows for direct visualization and polyp removal, interrupting the adenoma-carcinoma sequence. Screening is now recommended starting at age 45 years and repeated every 10 years for normal or benign findings. In high-risk individuals, screening starts earlier with more frequent screenings for those with family history or other risk factors. Fecal immunochemical test is a non-invasive annual stool-based test that detects occult blood, an early sign of colorectal neoplasia. While not as comprehensive as colonoscopy, it offers a low-barrier screening option for those hesitant to undergo invasive procedures. Positive FIT results require follow-up colonoscopy. Thank you for watching. We hope this information empowers you to take proactive steps in colorectal cancer prevention. Please like, comment, and share this video to spread awareness.